Hi, my name is Brent Steineckert. I'm from Sharp Healthcare. I'm here to talk a little bit about telehealth and virtual care. So the first thing is, what is telehealth? It's a term you may or may not have heard. It's referred to in a variety of different ways. Some people call it video visits. Some people call it remote monitoring. Others call it virtual care. Some may even refer to it as secure messaging or email. And the truth is, it's really all of these things. And probably the easiest way I can explain a definition of telehealth is that it's everything that happens outside of that doctor visit between you and the healthcare provider. So it's everything that happens outside of the exam room, everything that happens outside of the hospital. And it's all those interactions that come into play, usually supported by technology. And the technology can be as fancy as a digital smartwatch or a mobile phone, or it can be as simple as just a regular phone call. So to give you a little example of what telehealth is, I'm going to play a short video with one of our patients and physicians that takes you through the journey of telehealth as it means to the patient.
Change is hard for anyone, especially in medicine.
I think these technological changes are definitely here to stay, and they're definitely going to increase.
It's hard to break change, and it's hard to get over those barriers, but you've got to lead. You lead by example.
Muñequita linda.
Felipe has multiple medical problems. He has high blood pressure, he has cholesterol issues, and diabetes.
Porque no me tomaba la medicina.
However, at that time, I didn't care about taking any medication or taking care of myself.
He woke up one morning and he said his vision was blurry. The next morning, he went completely blind.
It affected me a lot because prior to that, I didn't rely on anyone.
It's hard. It's not the same anymore. I would like him to see what we see.
I'm no longer able to provide for my wife, for my children, grandchildren, and even my elderly father who's still alive.
It's really difficult now. I'm not only his caregiver, but also the head of household.
I couldn't go to the doctor anymore. I couldn't go to the store anymore. And I was unable to see the birth of my granddaughter.
Con mi corazón. Toma. ¿Sí? ¿Le gustó mi muñeca?
Unfortunately, in Felipe's condition, diabetes doesn't go away.
He's going to need ongoing care for the rest of his life.
They came late to an appointment one time, and we asked why.
We have to take the trolley from here to San Diego, then take another one to Chula Vista. From there, we have to take buses to the doctor's office.
Spending over 5 hours a day just for a visit to get in.
And not to mention that we often miss his meal periods.
Being legally blind, he cannot come here by himself.
My job was at stake as well. I was getting write-ups because I was having to call in so much. For families like us, sometimes we can't even make it to the doctor's office.
If he misses appointments because of transportation issues, then obviously his medical problems will become worse than some.
One of our main initiatives is to make sure that all of our patients have good access.
In Felipe's case, being legally blind, he would fit the best criteria for us in order to do a telemedicine visit.
At first, my concern was that they weren't going to pay as much attention to him.
But as we tried it, I got comfortable with it. All I had to do is go for blood work, then make an appointment.
I click on the link and it goes right to them, and then we start the conversation. Hola Felipe, ¿cómo está?
Muy bien, gracias, doctor. ¿Y usted?
It's very easy. You actually enjoy it. You're receiving the care that you need when you need it.
And it's just the same thing as any other visit if they were to come to my office.
I felt that he answered all my questions, and he tended to me as if I was sitting in his office.
The quality of the care is excellent because, frankly, had he not had this opportunity, the reality is he would have probably skipped a lot of the visits and had no care.
We no longer spend many hours trying to get to his doctor.
My wife no longer takes time off from work for me.
I've noticed that he's much happier now.
So the benefits of our telemedicine program at Sharp Rees-Stealy are that we actually have their electronic medical record in front of us. I know their past medical history. I know their surgical history. I know everything about their family. I know what medication they're taking. And on top of the fact is that they trust us.
We did some surveys of our patients and they really hit the ball out of the park.
Everybody loved it. They said, oh, we want to do it again.
Next thing we know, we're getting calls, well, how come I can't do telemedicine yet?
I would like to thank everyone who collaborates to make this happen.
It's helped out our family, and I would recommend this to anyone that can benefit from this.
We're convinced that this works and this is a direction that we want to go.
And this is happening now today, and it's not sci-fi.
This works, this is good medicine.
It makes me feel that I can go on living my life normally as if nothing has happened.
So what's interesting about this video is this was filmed in 2015, 5 years ago. And for a number of years, Sharp Healthcare has been really focused on providing telehealth to its patients. Dr. Ed Green, who was pictured in the video, he's a passionate physician and really believes that the way to bring care to patients who have difficulty with travel, mobility challenges, maybe there's transportation issues. He really believes that telehealth is the answer for him to stay connected to his patients. In Felipe's story, this was a blind patient, who had difficulty getting to the doctor's office for his routine care. And this is incredibly common among our patient population. We have a lot of patients who simply can't show up to their visits because of the coordination of getting from where they are to our facilities. And telehealth offers a way for patients to easily access their physician and their care team. And what was also interesting, as you saw in the video, is that it wasn't just the patient, right? Felipe had his family around him, and they could take part in the visit, listen to what the doctor had to say, hear the instructions, hear the plan of care, and be part of the care team that takes care of Felipe going forward. And that's a really important part of telehealth and video visits in particular that you can't necessarily do with traditional office visits. So in the last several months, with the COVID-19 coronavirus pandemic, we've seen an explosion of telehealth services across healthcare systems. And this is more than just San Diego and California. This is across the country. 300% increase in virtual doctor visits. And the question I get asked a lot is, what's going to happen in the future? Are these telehealth services going to stay around? Are they going to go back to the way things were before COVID-19? And I've talked with a number of colleagues across the country, and all of them essentially say the same thing, that there's no putting the genie back in the bottle, that the telehealth services are here to stay. And part of what I want to talk about today with all of you is really explaining what the benefits are, some of the potential risks, and some of the things that you need to be mindful of if you're going to seek care virtually from your healthcare provider. So let's talk about the good and the bad. Obviously, there's a lot of good things with telehealth. It's extremely convenient. You can typically access a physician with just nothing other than a computer or a smartphone or a tablet. It can be sometimes cheaper than in-person visits. For a number of months at Sharp, we were offering telehealth services essentially for free for patients, no copay, no coinsurance. And this was a way for us to ensure that patients were not coming in because of the copay cost. And we lowered that cost barrier and enabled patients to come in. And even with services that have copay or coinsurance, the telehealth version of them tend to be a little bit cheaper than the traditional in-person office visits. The other parts that can be good about telehealth are the integration with other things that you may need. So for example, if you need to have laboratory work done, or radiology, or rehab, physical therapy, all of these services can be coordinated through that telehealth encounter. And of course, the predominant benefit of using telehealth virtual care services is that it's safer, right? You're not exposed to any of the potential diseases that may be present in the community if you're coming into the office or coming into the hospital to receive care. And even though every healthcare system does an incredible job of keeping their facilities safe and disinfecting and wearing personal protective equipment to keep the patient safe, there's nothing safer than a virtual encounter where there's no chance of you getting transmission from something you touch or someone you encounter. And so that's an important consideration as we navigate the rest of this pandemic. So that's the good. All right, now what about the bad? Well, as I'm sure many of you have experienced, there's technology issues. These smartphones and computers and the internet doesn't always work the way we want it to work, or as easily as the way we want it to work. Some of the costs and the co-pays can be really confusing. And it's hard to understand, if I'm going to do a virtual care visit with my doctor, how much is that going to cost me? And if I need to be referred to a specialist, or if I need to go get lab work, how much is that going to cost me? Is it going to be the same as it would be if I was in person? Is it going to be more? Is it going to be less? And this last point is something that I feel really passionate about, and it's something I'm focused on for the next 5 years, which is through these virtual encounters, you potentially are missing the healing touch that occurs in the exam room. There's no substitute for the empathy and the magic that happens when you're face-to-face with a physician, a nurse, a healthcare team, and they can see you, they can lay their hands on you, you can see them, and you can interact. And part of what I'm doing and really focused on is how do you bring that experience to the digital realm? How do you bring empathy into a virtual encounter? How do you bring that healing touch into a video visit? And I'm actually hoping that many of you can actually help answer those questions later on with the questions and answers. I'm curious to hear what things healthcare physicians and nurses and healthcare providers can do to create that good experience for you in a video visit or in virtual care. So let's talk about everyone's favorite subject, insurance coverage. Well, the good news is the federal government put a waiver in the docket that really freed up what is able to be covered under insurance. Prior to that, the coverage for telehealth services was really hit and miss. Some health plans would cover it, Medicare would cover it, but only in very limited circumstances. For example, you had to potentially be part of a federally qualified health center or from a rural community with poor access. There were all these requirements that had to be met for your visit with the physician to be covered. Otherwise, they consider it not covered. Fortunately, with this new waiver that's in the legislation, all these restrictions have been lifted. And for the most part, all health plans are covering some form of telehealth. Now, the catch is, even though it's covered, the cost to you may depend upon the type of health insurance you have, where you're seeking care, and whether or not it's part of an integrated system or a standalone system that's not part of your normal healthcare delivery network. So the good news is telehealth and virtual care for the most part is covered. The bad news is the exact nature of what you may have to pay as part of that cost is a little bit cloudy. And some of the things that you need to be watchful for are typically, if you're getting healthcare coverage through telehealth as part of your normal, with your normal doctor, your normal primary care physician, or your normal specialist, then those services tend to be a little bit cheaper than perhaps if you were to go to a standalone center that is a pure virtual healthcare provider. And the reason I say that is, although a lot of these independent standalone virtual care providers will offer a cheap initial visit, if they need to refer you for specialty care or lab or radiology, some of those costs can start to add up. And depending on where you're referred to, they may actually not be covered under your health plan, and so you might be on the hook for some of these payments. And so it's really, really important to understand when you seek these services to make sure you have a good idea of whether it's part of your normal healthcare provider network and whether those services are going to be covered, and also what your share of cost is going to be. So some of the tips for success in having a successful telehealth visit is listed here on the slide. But the complicating thing, and this isn't just San Diego, this is across the country, is every healthcare system potentially is using different technology to provide these services. So there is no one single telehealth platform for virtual care. And what that means to you is you may have to download a different app depending on where you live or who your healthcare provider is. You may have to do certain things, registration and sign up for accounts and things like that, that can make it a little bit difficult in the beginning. So the number one tip I have is when you are about to get one of these virtual care services is really read those instructions sent to you by the healthcare provider. They're going to go through exactly what you need to do, what kind of device you need, what kind of app, if any, you need, and what kind of steps you need to take so that you'll be ready for the time of the visit. The best systems are ones where you don't have to do much, right? The best telehealth platforms are ones where you can just get a reminder, click or tap on a link, and you're right there with your doctor. And those are the kind of systems that we're really focused on architecting in our healthcare system. And as easy as we can make it, there's still some challenges there. So the key is to read the instructions. The other thing that's important is be mindful of where you do the visit. This is, think about where you are and if there's going to be background noise, if the lighting is good. The physician or the healthcare practitioner that you're going to meet with virtually, they need to be able to see you and they need to be able to hear you. So if there's a lawnmower going on in the background or a weed whacker or something like that, you may want to move to a quieter room where you can have a more easier to be heard and easier to hear. So the other piece of that is what I listed here as number 4 is a really good practice for these virtual visits is if you have a headphone or headsets that can connect to the device that you're using, those are ideal for the visit because they kind of block out some of the background noise and allow you to hear the physician better as well as the physician is able to hear you more clearly. So one of the most common issues, and I've worked with literally hundreds of patients who've been doing telehealth visits in our healthcare system, and one of the most common issues they have is when you connect to a telehealth platform or fire up one of these apps on your mobile phone, it needs your permission to access the video and the microphone. And all of us are trained that, for privacy and security reasons, we're just used to saying, no, 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 don't grant access, say no, I want to keep myself private. But if you don't grant access to the video, the camera, and the microphone, then when you join your visit, the physician is not going to be able to hear you and not going to be able to see you. And so take some time when you're setting up the application or joining the visit that you pay attention to any pop-ups that come up and anything that says, in order to proceed, you need to grant permission for your microphone or you need to grant permission for your camera. You say allow or yes. You can always turn it off later if you need to, but for this visit, it's really important that you allow those services. And the last point is when you're considering virtual care and telehealth, look for options that are integrated. And by that I mean, typically when you go see the doctor, it's more than just that visit that happens, right? I mean, if you're going in there with symptoms or an illness or a chronic disease, a lot of what happens is after that doctor visit. You know, it deals with the lab tests that they order, the x-rays, the physical therapy, or a referral to a specialist. And when you do these virtual care services, if you pick systems that are integrated, then that handoff to the next level of care of what you need can be really easy and really seamless. On the other hand, if you're going to a system that is more standalone and maybe just provides, urgent care or primary care type services, then that handoff to the next level of care of what you need can be a little bit confusing. And in fact, can run into those issues I referenced earlier with copay coverage and insurance and cost for you out of network. And so my advice to you is if you're going to seek virtual care or telehealth services, make sure you're doing it with a system that has access to all those services that you potentially need, not just that one visit. The other piece that's important about accessing a system that's integrated or a system that has your own doctors in it is this idea of they already know you. And we interviewed recently, earlier in this year, before COVID, hundreds of patients. And we asked them, what are the things that you like and don't like when you need to seek care from a hospital or healthcare system? And the thing that they told us they don't like is when they show up and it's almost as if the physician or the nurse doesn't know them. Like they may have been going to them for 10 years and they're asking them to repeat, tell us what your health conditions are, your allergies, tell us your surgical history. And the patient is thinking, well, gosh, I've been going to you for 10 years. Shouldn't you know all that? I've seen you type in the computer. It should all be there. And that's absolutely true. And so one of the things that they told us they did not like was having to repeat all that information. On the same token, what they told us they really did like about coming to the physician or the hospital was when they did feel known. So when their physician could ask them about their grandkids, could ask them about that vacation they took 3 months ago, could ask them how their knee pain is doing because that was something that was concerning during their last visit. And this is why I think it's for these telehealth services and virtual care services to bring that empathy and that experience into the virtual encounter. It's really important that you're picking physicians that you already know or a healthcare team that knows you. The difference between some of the standalone systems and the integrated systems is kind of like what I mentioned previously, is for some of the standalone systems, you may have to repeat your entire medical history, and that's something that patients told us they did not like doing. And so when we started to offer things like virtual urgent care, on-demand urgent care where you could go online and get a virtual visit, almost immediately, we were very thoughtful about making sure that the physicians who were on that line and in that encounter were the same physicians that you would see in our clinics. And they had access to your record, they had access to your specialist, they have access to your primary care physician, and they can correspond and coordinate your care. And in fact, in our system, the same doctor you may be talking through in a video visit could be the same doctor that you would actually see in person if you were to come to one of our clinics or one of our urgent cares. And that's one of the benefits I think that's really important in seeking care from a system that's integrated. So let's talk about a couple patient stories. before I came to this talk, I asked our physicians to share with me stories of their patients who were seeking telehealth through virtual care, and why they chose virtual care and video visits versus a traditional in-person visit, and what the benefits were to the patient. So in one example, is a 100-year-old patient who lives greater than 180 miles away, and she was having eye pain, and she has been treated by one of our eye surgeons, Dr. Tommy Korn, and she was just concerned that she had something going on. Now, she's 180 miles away. This is the height of coronavirus scares, and the last thing she wants to do is have to drive for hours and hours. And in fact, she can't drive. She has to coordinate care with her family. And so what Tommy Korn did was he used FaceTime, which hopefully many of you are familiar with, FaceTime video visits in your personal lives, talking to your family members, doing video visits with friends, that kind of thing. He used FaceTime to connect to this patient and actually have them, take their iPhone and hold it up close enough to the eye where he could get a really good picture of what was going on and assess for that patient if it was something really serious that she needed to come into the clinic for immediate treatment, or if it was something that could be treated, by prescribing some medications or prescribing some therapy that could be done at home. And it turned out that it was the latter. And he was able to treat this patient by prescribing some medications. She was able to get them from the local pharmacy, have them delivered, and in 2 weeks she was feeling much better. And so she expressed to Tommy Korn, thank you for offering this service, because I don't know what I would have done without it. I probably would have had to gone to the emergency department, locally, wait for hours and hours to be seen, be referred to an eye doctor, and then have the same end result. Another patient was vacationing in Lake Tahoe and needed to have some concerns about a chronic illness addressed. And so this patient actually contacted her primary care physician and reviewed her concerns remotely from Lake Tahoe, and the doctor was able to give her some exercises and some treatment that was able to be done in Lake Tahoe without her having to, journey back to San Diego. She didn't have to cancel her vacation. She could continue to be up there with her family, and everything worked out great. We also have a lot of college students who are on campus, and they may be, typically they're still under their parents' insurance. And so some of these students may contact their primary care physician from whatever campus they're on and need either questions about medications or maybe some illness they have going on. And so these are common examples of how we deliver virtual care to that population. And the last patient story I have is related to, it's a personal story, and it's related to my mother, who was diagnosed a couple years ago with breast cancer. And for those of you who had dealt with cancer either personally or as a family member, you know that the diagnosis is just the beginning. There's a whole coordination of care that happens afterwards that can be really complex and really confusing. There's the consultation with the oncologist. There's imaging tests and lab tests. There's consultation with the surgeon. There's a discussion about risks and benefits with procedures that you can do. And I went through all of this with my mom and our family. And one of the things that I learned firsthand was just how confusing it really is. And I also learned that so much information is given to you during these office visits that it's almost impossible to remember everything. And one of the things that it really inspired in me was, as we're building out this new digital healthcare capability, we really need to take into account that all this information that's conveyed needs to be accessible to the patient and their family, and in an easy and friendly way. And so in coordinating my mom's care, usually my sister or I would go to the office visits, and we'd actually take notepads and be writing down everything the doctor said. We would also be helping her coordinate the visits, talking with the care team that was coordinating the follow-up appointments, the imaging tests, the lab tests, and mapping that all out on the calendar. Once she went through surgery, we had to do essentially the same thing with the pre-surgical care, the surgical care, and then the post-surgical care. All of that coordination and follow-up was pretty much relegated to the family members to make sure that everything that my mom was supposed to do to get better, she was able to do. And the good news is she's had a recent video visit with her oncologist. She's been cancer-free for a couple years now, and things are looking really good. So we're really happy ending as that story. But one of the lasting messages that I took away from it is we got to make this better. And so part of what we're going to be focusing on is how we really improve that experience for patients. So this slide is a lot of text, I realize, but what it is, these are the comments from patients about the virtual care experience. And so when coronavirus first hit the United States, in terms of its peak around March, most healthcare systems had to rapidly switch to this virtual care offerings. And in fact, most of them, including our own, Sharp here in San Diego, about 70% of all our visits were virtual. Now before that, it was 1%. So you're talking a rapid increase in virtual care almost overnight. The good news, as you saw in the video earlier in the presentation, we've been doing this since 2015, so we had a pretty good track record of how to scale it up, ramp it up quickly. But at the same token, it was a massive undertaking, and we were really concerned that our patients felt disrupted, that they couldn't come into the clinics and do their normal in-person exam room visit. So we asked them through patient surveys, through social media, to let us know how these virtual care services went for them. And fortunately, as you can see some of these comments on here, they were really happy that they were still able to get the care they needed without having exposed themselves to potential infections in the clinic or just traveling. And for them, it was a really good experience. So a couple emerging trends in terms of what's happening in the future. Some of you may have heard about Amazon has recently gotten into the healthcare market with their Halo band. And the Halo band is kind of interesting in the sense that it's really, really simple. There's no screen, there's no complexity, but what it's doing is listening to the environment around you. And yeah, I know, it sounds a little creepy, but part of what they're saying is that by detecting your voice and how you're speaking and how you're interacting with others, it can measure your mood, it can kind of plot how you're doing throughout the day and over time, and can give you useful feedback on how to improve things. It's relatively new, there's still a lot of research to be done on it. The Apple of course, has their Apple Watch. They recently released the version 6 of it, which has not only the EKG built into it, but a pulse oximetry device. And so I recently picked one up because I have chronic obstructive lung disease that, for me, requires pulse oximetry. It's for me to monitor my blood oxygen level just to make sure I'm not having any issues with my lungs. And so this device is a way for me as the patient to take a little bit more control over my own healthcare. And that's kind of the bottom line emerging trend that I want to convey to all of you, is what's happening in the in the wearable space is a movement from taking everything that normally happens in the doctor's office and bringing it out to the patient. It's giving you the tools to take care of yourself, to monitor your own health care, and to take care of your family members. And why that's important is because it's potentially easier for you to track your health. It's also cheaper in the sense that you don't have to go in and pay a copay visit every time you want to do an EKG or check your heart rate or detect for anything going on in your health status. The last item up here on the right is a little kit. It's called a TytoCare kit. You can buy it at Best Buy for $200, $300. And what it is, it's a kit that has all those devices that are in the doctor's office exam room. It has the device to look in your ears, to look at your throat, to look at your pulse and respiratory rate. And this actually allows you to, at home or wherever you are, essentially have your vitals and exam done, and the doctor can in real time or afterwards, because you can record all this information, review your visit data and then make some medical decisions just like he or she would in the doctor's office. So what's interesting about Best Buy is, they recently acquired a healthcare company here in San Diego that provides remote monitoring services for patients. You may think, well, what Best Buy? They sell TVs and computers and audio equipment. Why would they be getting into healthcare? And one of the reasons is they recognize that this is an emerging market and that patients want to be able to track more of their healthcare at home and not have to come into the doctor's office each and every time. So Best Buy already has an entire team of healthcare technicians ready to come into your home and help you set these up. And you know what they're called? That's right, the Geek Squad, right? So they are retraining their Geek Squad staff to come into your house, install these health devices, just like they would install a TV or stereo, and get it all set up for you. And that way you can remain connected to your doctor and your healthcare system pretty easily. So to kind of wrap things up, I want to start talking about the future and what are we building. So I told you about the story with my mother and the complexity that went into managing her care. And this is kind of this slide represents sort of a roadmap of what we're building now. And essentially the way to look at it is just a way to coordinate your doctor's office visits, when you're due for things, being able to easily connect with your healthcare system, whether it's through email or text or regular phone calls. We want to build all of that into this environment. We also want to make the front door really easy to access and not be confusing. And the idea is so that you have a virtual team of people who are going to be looking after you outside of the doctor's office and going to be letting you know when things are due or overdue, communication about your health status. It also gives you the opportunity to ask questions, to review education, to look at your own healthcare record, because what we're going to be launching in November is publishing essentially every patient's medical record to themselves. And not just a summary, but actually what the doctor sees in front of them is the same thing the patient's going to see on their device, their own progress notes and medical record. The other thing that we're really doing to create this experience is we're focusing on this concept that we call website manner. And it goes back to what I was talking about previously, which is how do you bring that magic that happens in the exam room, that experience, into this virtual realm? And so we are actually training our physicians and staff to do that. And there's a variety of things that we have to do, but a lot of it, is listed here on the slide. But the main thing that we're focused on is how do you make that video visit special? How do you make that secure email express empathy? These are the questions that we're addressing and going to be focused on in the upcoming years. So, to conclude, I actually have some questions for all of you. What do you want from telehealth? Number one, what is the most important element to make it a good experience? What does website manner mean to you as the patient? Number two, what advice do you have for physicians, nurses, healthcare providers to improve the way things are? Number three, and what do you want to see improved in the future? What are you excited about? What are you perhaps a little bit fearful of? And what are the things that you need to take care of yourself? And I'm here to listen, and I look forward to your questions and comments. Thank you very much.